webinar of FilmMed e-Academy this evening. As you can see on the screen, several webinars are scheduled this week. If you haven't already registered for the ones to come, please do so by going on the FilmMed website, filmed.com, click on Pro Access, log in, and then join the webinar. Additional webinars are also scheduled next week. The program will be very soon available. So leading this webinar is Dr. Valérie Philippon, a French aesthetic physician practicing in Paris. She will be presenting a new way to treat the delicate areas of the face with a safe and an efficient procedure by using Nctf and Nanosoft, a new exclusive device distributed by FilmMed since 2019. Before we begin, I would like to let you know that your micros are turned off, but you can also turn off your cameras. I would also like to add that today's presentation will last 20 minutes and we will have 10 additional minutes at the end for questions and answers. So if you have any questions, feel free to submit them through the chat feature on the right of your screen. Also, please leave us feedback as we hope to improve our future webinars. The one of today is registered and is going to be available on replay. So before further ado, I now pass you Dr. Valérie Philippon.
Hello, everybody. Thank you so much, Dimitra, to organize with all the FilmMed these webinars that allowed us first to maintain connected and then to get added value for our practice coming soon. So today it will be my pleasure to present you an Nctf with the new device that has been launched 1 year ago by FilmMed, the Nanosoft, in order to treat the delicate area. When we are talking about delicate areas, it meets anyway women's concern. We're going to talk about dark circle, lower eyelid, superior eyelid, crossfit, and also neck and décolletage. These areas are very important because they are the first area to first sign of aging. They are continuous in movement and they are very difficult and tricky to be treated due to many vessels, very thin skin. So in order to maintain this challenge, we have a very easy solution, that is to have the right product, Nctf 165HA, with the right injection depth in the dermoepidermic junction with the right technique, which will be able with standardized procedure with Nanosoft. First, why it is the right technique? Nctf new cellular treatment factors is really an iconic product due to its unique formula presented in Preclinical. It's a unique combination of HA concentrate of 5 mg per ml plus 59 ingredients, all the ingredients working to restart, reboost the aging or tired fibroblasts. Vitamins like C, E, D, amino acids to build collagen, elastin, coenzyme nucleic acids to stimulate metabolic correction, minerals like magnesium, calcium, and antioxidant to have protective actions. All these have been sterilized by double filtration in order to guarantee the efficiency of all these nutrients. So to promote the activities of the fibroblast, which is the key cells to enhance collagen, elastin, and HA, Nctf will create the right and the optimal ecosystems. Nctf do have also the specificity to bring patients prevention and correction by preserving skin health and correcting the first sign of aging. Very important when we're talking about skin quality, which is a major demand of all the aesthetic patients after before surgery, after before laser, after before peeling, after before injections. They have to maintain through the age a good quality. It means density, elasticity, wrinkles, homogeneity, radiance, pore size, hydration. That's why today 8 vials of Nctf are sold per minute, which means it's a real success, appreciated both by physicians and patients. Just to remind you, the first CE certified biorevitalization product, 40 years of research and expertise, thanks to Dr. Michel Torchman. And also it is being quoted as one of the first bestsellers product of anti-aging of this latest 20 years. We do have a lot of clinical study, both about the Nctf formulations, the science of methotherapies, the bioskin engineering, the methodtherapy for skin rejuvenation. Thank you to all these leaders, and Kauer, Ricky Smith, Sylvie Bosnick, Frédéric Bracchini, Frédéric Prikhenko, Philippe Amida-Pizal, together to work on the clinical evidence that makes Nctf really different. Nctf for us physicians is very easy to prescribe because it can be all the year round, whatever the age, whatever the season, whatever the phototype. It can be injected in single use, but also in combined use after all anti-aging procedure, to prepare to maintain surgery, to prepare to maintain peeling, HA, lasers, and most important is its maintenance. It's quite a good addiction to Nctf to have through the age a good quality of skin. Nctf has been scientifically proven by many kinds of device, and the best device is yours. If you prefer injection, you can use 30 or 32 gauge needle with 5 sessions, nearly soon 3 session protocols coming. If you prefer roller, you can use roller of 0.5 or 1 millimeter. If you prefer needle pen, you can use it with the length depending of the area you're going to correct. If you prefer mesogun, it will be also yours. But today Nanosoft will bring something really different that was today impossible, is to treat delicate areas. Nanosoft is a needle with 3 microneedles on it that has been directly inspired from vaccine administration, and it provides minimal pain, minimum trauma, and standardized injection depth. 3 microneedles of 0.6 millimeter length each. Optimal design you can adapt on all Luer lock syringe, and very easy to handle. Easy to handle, nevertheless, you need to have some tips and tricks to make it efficiently. These tips and tricks, please go up this video. First of all, the blue line in front of your eyes, and really perpendicular. It has to be very precise. Then this microneedle have a cover. You will present it 45 degrees where you want to inject. You maintain, first you prefill your syringe with Nctf. You take off the cover. You take off the drop. And then on the skin that has been very well prepared without anesthesia, but lots of asepsia. It has to be very clean. You will inject slowly, very slowly. Here to start with, I advise you to start on the neck. And you will follow the line, follow the fine line, deposit some very small drop. And look, point by point, you will be able to have some small papilla. That's the end point to say you are at the right position with the right product, with the right device. This small papilla of Nctf will disappear between 20 minutes and 2 hours. It depends on the skin of your patients. Please do not inject the dark circle when there is some bag. It will provide some edema. Okay? What's very important also not to do is if you do not face the blue line, the little needle will not grip, and you do not to exert the pressure on the syringe because the Nctf will not be able to be deposited. So just 3 tips and tricks. blue line in front of you, 45 degree, deposit some small papilla that will disappear very quickly. I want to show you what makes the difference between Nanosoft and a classical needle. On the top, you have, represented by the blue, the Nctf, that is deposit with needle under the dermis. On the lower part, you have the Nctf deposit just where it has to be in the dermo-epidermic junction. And you can see that why the Nctf is so efficient, because it is injected where it has to be to stimulate the fibroblast. In 3 words, key messages: standardized injection depth for optimal efficiency, nearly painless, so people do not fear to come back, and it ensures full compliance of the protocol, and reduce risk of bruising because 0.6 mm 36 gauge do not have any risk to penetrate the vessel, so it is definitely very safe. Safe, better, quicker result in less time. Just look through this video, another injection live demo. Very interesting. After toxin, if you want to erase the fine lines. After blepharoplasty, if you want to maintain good density. For millennial with dark circle, you can really provide and correct little dark circle with this protocol of 3 sessions. As you can see, it is very comfortable. You can really go to the internal contours without any risk. So, Nctf using Nanosoft allowed you to go in this delicate area you couldn't go before, even with a 30 gauge needle. I very often also lift up, the upper eyelid, which is very interesting in terms of prevention. You can also use Nctf with Nanosoft after a peeling like bright peel. For the neck and décolletage, very interesting in prevention in order, to avoid dehydration and treatment of the fine lines. So, after, even if you have some drop of Nctf left on the skin, you just have to do a massage and it will penetrate. It's also excellent for the décolletage. So now, on the other side, you see this protocol is very quickly, how would I say, implemented. You can use one single vial to do both the periorbital area and the neck. Depending the grade of aging, if you want to do all the neck and the décolletage, you will need to use about 2 vials. Usually, people are likely to come back and to maintain after the 3 sessions, another session, let's say 6 or 9 months after. So they are so pleased with the results. Always finish with a massage using skin perfusion B3 recovery in order to smooth the skin. B3 recovery is very interesting because it contains B3 to regenerate and URE for repairment. And now it will be my pleasure to show you, thank you to Sergio Fernandez, the before and after 4 sessions. As you can see, it's a very good treatment to dark circles. Look, after 1 session, this kind of fine wrinkles, we didn't have any treatment before, neither laser, no peelings, no injection. And here, the clinical study, which is still going on, we will have soon the results to use Nanosoft versus regular needle and to have endpoint on hydration, elasticity, wrinkles, and homogeneity. So thank you for your attention. Just few words on Nctf contraindications, injection in blood vessels, injection or pregnant breastfeeding woman, injection never with any kind of skin disease, and hypersensitivity, neither autoimmune disease. So now I am ready to answer any question.
Okay, thank you so much, Doctor. It was really interesting. And now I would like to invite everyone to submit your questions if you have some on the chat. And waiting for some new questions, Doctor, I have one from the last session of Nanosoft. We didn't have time enough to reply to everyone. So one of the questions was, what is the dosing in each area of Nctf in order to treat the eye contour area? How much product do you recommend to inject in order to have an eye contour, a smooth eye contour?
I recommend for the eye area to use half a vial for both. It's always depending, you know, on the case of the latest patient. She was young, like a millennial. Half a vial is enough to treat both, you know, periocular region, and half a vial for the neck. If you want to treat all the décolletage plus the neck, you have to use 2 vials. What is very important is not so much the quantity of Nctf deposit, because it's very small quantity in each papilla. It is the fact to repeat it very closely with small papilla, very well positioning in the dermoepidermic junction due to Nanosoft.
Okay, thank you so much. There is another question, but I think that you already responded. Can this procedure be used in the perioral area as well?
No, honestly, it's not possible. It depends. Well, I say no because the perioral area, very often the dermis is very thick and you can't get it, excepting if you have very elastosis skin, where you'll be able to use it. But honestly, it's not the best place area to use Nanosoft. Nanosoft is really dedicated to the periorbital contour and to the neck and décolletage, and sometimes using for very old skin, age skin elastosis. Sometimes you have to try. You can put some small papilla.
Thank you so much.
Thank you.
Sorry, I have a new question. Can we inject it with Botox in the same session or in different sessions with Nanosoft?
I do know some of my colleagues that do mix Botox and Nctf in the forehead or in the CrossFit with very good using both Nctf and Botox with very good result. Personally, we do not have this regulatory acceptance in France, neither in the regulatory of Nctf, but it's on their own decision. But some use it, especially also for the neck, with very good results.
Thank you so much. There is another question. I'm not sure to understand very well, but it's what about Tyndall effect in the periocular zone?
That's a very good question, Dimitra. Thank you. You do not have any risk of Tyndall effect because the HA inside Nctf is not reticulated. It is free HA. The only risk in this area is not to inject Nctf if there is some bags, because it will create edema.
Okay, thank you so much. A new question is, could you tell us the number and time of treatment for a complete cycle of therapy?
So the number is 3 sessions, spaced out of 3 weeks. The time per patient to do both neck, décolletage, and perioral is 15 minutes. Because once you feel comfortable with the right, how would I say, accurate injection techniques, it is really very quick. And it's totally different when you have a 32 gauge and you risk to go through vessels and you are so efficient, much more with whatever a needle pen or a gun or a roller, and it is more comfortable, that honestly you gain on all the criteria: time, comfort, efficiency, safe.
Thank you so much. Another question is, can we combine the revitalization process with platelet-rich plasma?
Yes. I was recently in an aesthetic mesotherapy congress. It was the latest one I was, 6th of March, and there was lots of experts of PRP and mesotherapy, and they do like to mix it with excellent results.
Great. And how often do you have to change the needle in a session?
No, you do not have to change. There is no, the needles are in silicone and you do not have to change. One needle, 1, 2, 3 vial in one session. You do not have to change. The sharpness of the needle remains the same.
Okay, and I have a last question. It's that sometimes there is an hypertrophy of sebaceous glands in periocular area after HA injection. Is it possible? And what is your opinion about that?
I do not have this experience.
Okay.
So I can't answer. I'm sorry.
Okay, thank you so much. I think that there are not further questions. So I don't know if Dr. Philippon, if you would like to say something more, or if we can end the session right now.
Well, I want to thank you all, my dear FilmMed team, because it's a pleasure to work with you. You work very hard behind the screen, Charles, Annelise, Bérangère, Dimitra, of course. And honestly, thank you to all your efforts that allow lots of physicians to remain connected and to go more in depth of FilmMed protocols, product, but more than that, to all the human being you are. So I wish you a good evening, good afternoon, good morning. I don't know where it's connected for what, and all the pleasure we have to see again soon, I hope.
Okay, thank you. Thank you so much, Doctor. Thank to all of you that participated to this webinar. Please do not forget that tomorrow there will be 2 new webinars. The first one at 4 p.m. with Dr. Ricky Smith from South Africa, and it's going to concern the lip menu. And the second one at 5 p.m. French time with Dr. Valerie Philippon on BioNutriLift protocol. So I would like to thank you again, wish you a good evening, and of course, be safe. Bye-bye.
Thank you, Dimitra.